All right, good morning. It's time to start our press briefing. This morning we'll start by going to our Heavenly Father in prayer. You bow your heads. Dear gracious Heavenly Father, we thank you for this day and all the many blessings. Lord, we thank you once again for giving us an opportunity to be leaders in this community. Lord, we pray that you give us the wisdom and guidance to lead our community in the right direction. We pray for our doctors, our nurses, all of our first responders, Lord, that are help dealing with this COVID-19 virus that has plagued our country. Lord, we pray that you give them also the knowledge and the wisdom, along with the doctors and the scientists, to come up with a cure for this COVID-19. We ask you to forgive us of our sins, be with all of our men and women serving our country as we just celebrated Memorial Day, Lord, and comfort those families that have lost loved ones. Forgive us of our sins, Christ, and we pray. Amen. Okay, as far as for the city reports, there's really nothing new to be reported. We have not opened our splash pad this year so far due to the COVID-19 virus. It's indefinite exactly when that will open. And also, it goes with our playgrounds. Social distance is still recommended by the CDC. I want to echo Governor Lee on his executive order that was out, executive order number 38. For individuals maintaining at least 6 feet of distance from other persons, practicing good personal hygiene, and observing other CDC recommendations, remaining at home if you feel sick, working from home whenever possible, avoiding discretionary travel and large gatherings, and avoiding visitations or close contact with vulnerable persons or those who are sick, and for employers, implementing appropriate policies and practices in accordance with state and federal guidance to facilitate social distancing, temperature checks, sanitation use and disinfection of common areas, and reduce business travel, monitoring employees for symptoms and prohibiting employees with symptoms from returning to work until cleared by a medical provider. Cooperate with governmental contract tracing procedures for employees of customs who test positive for COVID-19. Today, we have with us is Scott Stevens from Overton County Health and Rehab. We have Dr. Mark Winningham from the Overton County School System, and we also have Miss Megan Reeder from Tennessee Department of Health. So at this time, I'll turn it over to Mr. Scott Stevens. Thank you, Scott, for that report. We'll try to get you a little bit more audio next time. A great report from the Overton County Health and Rehab, and you folks have just done a fantastic job over there, Scott. You and your team, just keep up the good work. Next, I have from Overton County Schools, Dr. Mark Willingham.
Yeah. Good morning. Thank you, Mayor, for hosting this and inviting me to come. I appreciate it. Thanks everyone for joining us. Just a real quick update from the school system. We are planning graduation for the high school June the 14th at Tucker Stadium in Cookeville, and that will be at 2 o'clock. And I believe there was a message sent out this morning about that. If it were to rain on that day, it will be the following week on June 21st. We are making plans for next year. Right now we have 3 plans in place. One for every student to be back in school. We have a plan if we have to stagger a schedule where half are in school a few days of the week, the other students will be at home, and then they would change that in the next couple of days where the ones that were at home will be back at school, and then we just continue that through the year as long as we needed to, and then one for no one at school. But right now we're not sure exactly what school will look like when it starts back. We'll keep you apprised of that as we go through the summer. Athletics will begin June the 1st on a limited basis, and there's messages going out about that as well. And that's really the only updates that we have as of right now. Thank you, and God bless everyone.
Thank you, Dr. Willingham. Okay, next we have on the phone with us Livingston Regional Hospital, Mr. Tim McGill.
Good morning.
Morning.
Earlier this spring, we postponed elective surgery cases, but now we're back closer to normal in providing elective surgeries, in fact, all surgeries, as social distancing is a big component of this. We now have fewer surgical patients in our operating room space at any given time. In other words, we're staggering cases to help accomplish our social distancing requirements. Right now, we're operating at about 70% of our previous surgery capacity. As patients come back and reschedule, we encourage any patient that had a surgical case postponed earlier this spring to contact your physician office so that you can be rescheduled for cases at LRH at your earliest convenience. Our visitor policy, although we're still zero visitation, in the future this will be revised. We'll announce this at a later date as we continue to monitor the data in our region to help us guide us on our decision. Testing, we provide testing to our collecting specimens, our for ER patients and for inpatients. But our ultimate goal is actually to provide on-site testing results same day in time, and we hope to have an update on this in about a month or so. Again, our goal is to provide same-day testing and results on our campus in the very near future. Lastly, physician practices are back up and operating normal basis, seeing patients regularly. We encourage all patients in the region to keep their physician appointments, schedule your wellness exams, and to try to stay ahead of any illness this summer. That's our report for Livingston Regional Hospital. Thank you very much.
Thank you, Mr. Tim McGill. Next, we will have Miss Megan Reeder from Overton County Health Department. Health Department. Thank you. Come on up. I'll spit it out in a minute.
Thank you, and thank you for allowing me to be here. First of all, I would just like to start off with testing and cases. So far in the state of Tennessee, we have 20,145 confirmed cases of COVID-19 as of today, 336 fatalities, 1,583 hospitalizations, 12,837 recovered, and as of Overton County, we have a total of 23 cases, 0 deaths, 1,211 negative tests. So something I would like to update you on, we're still currently testing daily at the health department from 9 to 3 each day until otherwise advertised. The National Guard is still there helping us, and we are gladly doing testing for these elective procedures like Mr. Tim McGill was talking about. Now, we would recommend that if you're going to have an elective procedure and you need testing, that you come at least 1 week prior to your procedure date. I know a lot of the providers want the testing as close as possible to the procedure date to have an accurate COVID test, but our problem is we can't ever guarantee how fast the lab's going to have a turnaround on the test. So just to ensure that we have your test results back and where they need to be and plenty of time for you to have your procedure, we recommend at least 1 week before your procedure, just to be on the safe side. So I wanted to talk to you a little bit about the degrees of contact. I have a lot of people ask me questions. So like an actual person that has been around a confirmed case, that would be like a 1st degree contact. And then somebody that's been around that person will be a 2nd degree and 3rd degree and so forth. So the further you go down the line, the less likely the infection is. So that's something I kind of wanted to give you guys some scenarios today because I have a lot of people asking me questions, and so I try to do some sort of education each time. So I brought with me my 3 little people here. So we've got a man, a woman, and a child. So our first one is going to be that we have the father, and he works at a business, and he has been around a coworker that is tested positive for COVID-19. So he is a primary contact, so he would need to isolate and to be tested for COVID-19. Now he has his wife and his 9-year-old son as well in the home. So what the wife and 9-year-old son should do is they should wear a mask and they should try to stay on the other side of the household with the husband. So, you know, if he's sleeping in the bedroom, maybe the wife needs to sleep on the couch or in the room with the son, something like that. But the wife and the son are not considered contagious at this point. It all depends on the father. So once the father isolates and get his test results back, if he is positive, then they will need to stay isolated because then they are direct contacts. But if he is negative, then the contact stops there. Okay, so that is one scenario. And then another scenario, say we have a child that's in a daycare system, and the caregiver of the child or the babysitter, maybe her sister was exposed 4 days ago to somebody that had COVID-19, but she's not been around her sister in 2 weeks. Okay, so there is no direct contact there. There is nothing that this family needs to do in any sort of precaution way because there's no direct contact. So don't let some of these hearsay things really scare you. So we want people to be cautious and to be proactive and take protection, but we also don't want you to be scared when you don't need to be scared. Another one is, say you have a lady and she starts running a fever and she decides to go and get tested for COVID-19. Well, then she is in turn positive, okay? So then that's where the husband and the son are direct contacts. So the whole family needs to remain isolated, and actually the husband and the son's isolation time is going to be longer than the woman's because she is already positive. We know she's positive. She has to remain in isolation a minimum of 10 days, with the last 3 of those being no symptoms at all, and that's without medication. So we don't want you to take medicine and feel better and think everything's fine. We want to know that you are fine without medication because those can mask a lot of those symptoms. So she's going to remain in isolation at least 10 days. Now, for every day after day 7 that she does not feel well, that's going to prolong her isolation. But when you're looking at the husband and the son, they're guaranteed at least 14 days of isolation because we know the incubation time for this virus is 7 days. So you've got to give them their 7 days to get sick in the first place, and then if they are sick, we don't know, are they going to have symptoms? Are they not going to have symptoms? Every person's different, so then we have to allow for that time for them to process that illness and actually get that virus shed completely out of their body. So they would all be considered at that point direct contacts, and nobody needs to leave that house unless it's to seek medical care, emergent medical care, and then they would need to call first. So like groceries and things like that, that's where it'd be helpful if they had a family member that could leave it at the doorstep for them, and then that person would need to make sure and clean their hands. They wouldn't want to have any direct contact. We wouldn't want the family on the porch when the people are leaving the groceries on the porch. We want door closed, leave the groceries. that person leaves, and then the family can come out and get their groceries and things like that. So just wanted to give you some scenarios. There are definitely positives where we need to remain isolated. We don't need to go anywhere. And then there's some things that it's not quite as prudent as what we think. And okay, well, because we've got those different degrees out, maybe it's a 3rd or 4th degree contact. Just because A was around B that was around C doesn't mean that D necessarily needs to be worried. So just wanted to give you some scenarios. By all means, if any of you all have any questions and are worried or concerned, just call us there at the health department. We'll try to answer your questions the best we can. And thank you so much for letting us be a part of this, and you all have a good day.
That concludes our briefing today. Thank everybody, all our participants for being here, and thank the media for coming out too. We'll let you know when we have another one scheduled in the near future. Thank you very much. God bless Overton County.